With that said, let me introduce my very first guest. With me, I have Dr. Richard at the far end there, and Misheni Mike, who's the Director of Public Relations, and Dr. Richard is the founder CEO of Dr. Little Kenya. Karibuni sana to the show.
Thank you very much.
I like this name though, Dr. Little. What inspired that?
I let my founder expand on that.
I think I have a love for kids, and I was introduced at one point to go to children's home in Kawasukari, and they were like little girls, and so we were playing around. I had a stethoscope that was written Little Doctor.
Oh.
So from there, I think the children wanted to play with it, and then the name came up. Okay, so I think it's gonna be Dr. Little Kenya,
Yeah.
and then so that's how it started up, and we started visiting children's homes, and then from children's homes it went to having medical camps, and so we've been building like that, and then now we are doing community healthcare. Yeah.
Community healthcare.
Yeah.
All right. So what are some of the activities that you guys then do, and which communities are you working in right now?
Okay, that's good. So we are actively involved in bridging the gap between the community, those in the community who need healthcare, especially children, considering how disadvantaged they are, and we link the children to healthcare providers. So that's what we do. So in everything that we're doing, that's our agenda. We do this through medical camps. So we support children in the community, and we also treat the immediate needs, like through the medical camp. We also do follow-ups from the medical camps so that we can find if there are any kids who need specific health needs. For example, we had a young boy around 2008 last year and the year before that. So we are involved in, he got an issue, he had an infection, he was younger, he had his leg amputated at some point. So we were helpful to him by providing him with a prosthesis. So just connecting the child to the healthcare provider. So that's what we do through the medical camps, through the community outreaches, and through reaching out and helping specific people to the best of our ability.
Right. Daktari.
Yes.
You know, when a lot of people are growing up, they're told, you know, you need to be a doctor, you need to be those hizo makaria za huko.
For sure.
Nyinyi wenye mnanunua hizo
Yes.
manyumba za huko. Hopefully, but you know, of course, being a doctor is a very glamorous profession in many ways, and I'm just curious as to how you've sort of almost, I don't want to say put that aside, but you've chosen to sort of redirect your focus as to who you treat and why you do what you do. And I just want you to share a bit about that. What keeps you there? So besides that trip and just seeing how the kids responded to your stethoscope and to having a love for children, you know, to take a career like that one that can really take you almost anywhere, economically, financially, socially, you know, what's behind you with the reason you do what you do today?
I think growing up, I always grew up in a neighborhood whereby we were fortunate enough to have a big house or something of that sort. But we always had, for example, when we were living in Harambe, there were always kids from the neighborhood who were living in the slums. And so those were my best friends, right? And so when I grew up, I always had to sort of give them something that I had, because I felt like I want them also to have something. And growing up also, we were living next to Kibera. And so most of my friends also actually had like some sort of friendship with people in Kibera. So I always had that sort of connection that always reminded me that as much as I have, I always have to give back.
Right.
Yeah, and so with this, it was so easy for me to just come up with, okay, let's start Dr. Little and let's always give. There are children who don't have. I think with children, they're very vulnerable with the sense that, you know, they're taken care of. So if a child can't have someone to take care of, that means they have nothing.
Sure.
So with them, they are a very vulnerable group and they need much attention. And so with that, we sort of thought that, okay, fine, let's bring people together and let's start this foundation. And this is where we reached.
Yeah.
And truly, just if I may, I'm a medical student myself, so we share final profession. The end goal is going to be the same. And I think something that we've observed is we have so many people who want to help Kenyans and they want to help the community in whatever capacity that they can. So we reached out, we reached out to different volunteers, and you find that they're willing to bring whatever they have to the team. Because even as Dr. Little in our management, we are not all medics. So there's Richard, who's a doctor. And then there's Maya, who's into strategic partnerships, and she is not a medic. She's going to get there in due time, but she's not at the moment. Then we have Betty, who is the treasurer, involved in cash.
Okay.
And then we have Stephanie, who's a medic, and then me, so we're all bringing together something in whatever way that we can in order to help the community.
And so, Dr. Richard, then, what sort of medicine did you study, and did you get a chance then to practice it before jumping into? I assume you're doing this full time now.
Yes. So I was doing IT before I did medicine.
Okay.
But I did IT for 2 years, and then I realized, okay, fine, let me try. I didn't really like it, so that's when I started doing medicine. And so I studied medicine. I did 6 years of medicine, and from there I took a year gap, which is what I'm doing now, to focus back on medicine and technology, and to try now bring it together, whereby with Dr. Little, for a way to finance ourselves is to now try have a form of medical technology that we can support people in the communities, you know, and bring to primary health care.
Right. And talk to me about that then, Mishani, because you've mentioned there's this team and you have all sorts of people involved, and I like that you've thought about that from the very beginning.
For sure.
Someone doing partnerships, you're here doing PR, right? And it's very interesting to hear that, you know, with an initiative like this, but I'll be asking you about that shortly. But talk to us about the fundraising thing, right? Because a lot of us, I think, have different ideas of things we would want to do, but then we just know, mfuko,
For sure.
Yeah, that's true. That's true.
The pocket is not that deep,
For sure.
right? And so how do I begin something? How do I get people to buy into my vision and to the goal that I want to get, you know, to? Because a lot of us don't even start because of that very concern. So maybe it's not that I'm even trying to get rich out of this, but I'm just like, how am I going to sustain this anyways? How do you guys handle that?
So something that we realized, or that we started from the beginning, is we reach out to people and tell them that they can help us in whatever way that they can. So be it in support in kind, be it in support in cash, or even offering of their services. Good example is the same applies even to corporates when we reach out to them. For example, in 2018, we had our annual medical camp in Githurai. So we were wondering that we're going to be having over 200 volunteers coming in and 200 staff members. That's the medics, the nurses, and all the support staff. And we need a way to feed them because the event is running from like 9 until 4, 5. So we need a way to feed them. So we all sat together and we are floating ideas. And one of us just said, I won't say it was me, but one of us just says, let's go to KFC. Let's tell KFC we want their support. We send an email, we go to their offices, we're here for a meeting. And in the end, through the PR team of KFC through Jemima, they were able to support us and they fed us for free.
Wow.
So you reach out to different people telling them you can assist us. Moreover, somewhere where we go wrong is when we think that we should focus on getting the money.
I was going to say that.
Yes, if you focus on the money, you will end up losing it all. Once you have the passion for it and you're focused on getting to the end goal, the money has a way of tagging along because people will see what you have, people will see and they'll desire to partner with you in whatever it is that you're doing.
But it's a great point that you've raised before we come back to you, Dr. that allow people to support you in the way that they can, right? So too many of us are out there, you know, saying, I want 200,000 shillings from you, but they don't have the cash flow to give you that either, but maybe they can support you in kind. They have, you know, a whole bunch of chicken sticks, chicken drumsticks that they can donate to this cause. And so it still helps your work. So I think it's also a matter of us being flexible about the type of support that we receive.
And I think people don't buy what you do, they buy why you do it. So for us, like, we just don't go and say, okay guys, we need about 500,000 for us to host a medical camp. I think they just like that interaction we have with people and say, okay guys, we are the field, there are children here, we are playing with them and they just need shoes. And we'd go to Kenafric and go like, we've met children and the only thing they need is just shoes. Can you be able to give us shoes? And so Kenafric gives us shoes and sweats. And then from our budget, we like go, okay, fine, we have shoes that we have cut down and all that. And I think in addition to that is planning. Planning really helps because, for example, for us to plan for a medical camp, it takes a year. Like for us to just have everything set down and go like, okay, fine, next time, like next year in January, we're going to have this and this and that. It has taken like probably a year of planning. So yeah, really helps.
As we get ready to wrap up, I want to hear from both of you what stands out to you as your biggest highlights from the work that you've done. How long has this been running?
3 years now.
3 years now. So both of you can touch on that as we get ready to wrap up this segment. We can start with you, Dr. What are some of your biggest highlights or moments, from running this initiative?
I think crying.
Crying.
Funny enough, it's
cried,
yeah. I think a month ago I was in Kakamega. We are doing a research in Kakamega
Okay.
on community healthcare and innovation. And so I'd gone to a home, and there was this mother, and she had her leg amputated. And I was the first person to see her after a year. And no one had gone to see her, and the family couldn't be able to take her to the hospital.
Wow.
And so when I went, the leg was actually in a very bad state, and the mother was crying, but she was holding herself because she was also happy because someone has finally come. And I was cleaning her wound, and I was just telling her, Mom, it's okay, you're gonna be fine, you're gonna be fine. And after that, 2 days later, she calls me and said, Daktari, I'm doing well, I'm doing fine. And it just gave me tears.
Yeah.
And I think that was like the highlight out of everything that I've done.
Wow.
The joy that someone just feels like you've
Just from
actually
you
helped me,
visiting
right?
and
Just from me
cleaning their
visiting
wound,
and
yeah.
being the first person to visit after probably a year of her situation and her condition. Because you can imagine she's the one who takes care of the home. She has 4 children, and the children have to take care of her now.
Sure.
So I think for me that
That's
probably would be
fantastic.
like,
That's really great. How about
Yeah,
you? Briefly.
there are many that I can choose from, but when we have the medical camp, there's a lot of planning that goes before it, and so much goes into it, into the delivery of the medical camp, for example. So in 2018, our last camp, there was so much, but at the end of the day, when you have the kids there, and they've all had a fantastic time, and we've offered them wholesome care. That we had a team of medics who offered medical care to the ones who needed it, and we had a team of we did preventative medicine, so training them on brush your teeth, wash your hands, and the like. And finally, at the end of the day, there was music, there was entertainment, so the kids had an all-rounded day. The ones who needed healthcare, they got it. And so just being a part of that story and seeing the joy on the children's faces, because the kids don't forget.
That's true.
They don't forget.
That's true. Really great to have you both here in studio.
Thank you.
When is your next camp, and where and how can people participate or support you guys? Very briefly. Najua uko PR, so najua.
So naweza ongea.
Najua, so sijui nitushei
we can
daktari.
start. So, very briefly. We have a community outreach in Kakamega. More details about it on our YouTube and on our other social media channels. We also have our website, Dr. Little. That's the word drlittle.org. That's the point of view for the Kakamega project. We'll also be having more projects in January, and so more on that. So just follow us on our social media platforms, and you'll get to know more about us.
All right. Thank you both so much, and all the best to you as you continue with your great work. And we look forward to hearing of even many more lives changed by the work that you do. All right, guys, we're going to take a short break now as we get ready for our next set of change makers. They're from Lenga Ugaidi na Talanta, and they're going to be telling us a bit about what they do, and that's coming up after this break. Stay tuned. This is Full Circle with Joyce.